Well, thank you very much. Thank you for inviting me. I've been with Google since 2007. I've worked here in the Nordics, and then for the last 3 years, before I just came back to Europe, I led a little group in Mountain View that worked on the long-time implications of technological change for society. I'll say up front that I'm not a healthcare expert. I will speak about what I know best, which is how technological development really impacts societies, and then I'll give you a couple of hints and examples from healthcare along the way that I think are relevant or that I've found interesting in the work that I've done. I will give you the legal disclaimer first, which says this is my views only. They're not representative of any planet, civilization, or any aliens. And then I'll give you an agenda. We have 30 minutes, and what we're going to do is that we're going to go through a guiding question. I'm going to give you a tentative answer. I'm going to speak about 2 strong drivers for social change, and then 3 challenges, 3 future trends, 1 perspective, and 3 observations, and that is a lot for 30 minutes. So let's see if we can get through it. The guiding question, and the question that we've been working with in Mountain View for a very long time now, is this: how does computer science influence society? It's easy to think that computer science is just another branch of mathematics, or that it's just another branch of engineering, but we actually believe that it's quite different. We believe that computer science is doing something much more interesting with society, with us, and we believe that the tentative answer to this is something that we and others have called the computational turn. Now, the computational turn is a creative analogy that essentially said that we can view the entire world as software. We can view the entire world as software. If we do that, and it's just an analogy, we will find new ways of interacting, we will find new ways of innovating, and we'll find new ways of solving problems. Now, what is software? The definition is actually quite simple. Software is data, set of data that you collect, that you get together. Data sets can be of all different kinds, and the code you run on that data to process it, to do calculations, things like that. And I'm going to give you an example from another discipline to sort of show you how the computational turn can look. So we're going to start with the humanities. Now, the computational turn in the humanities is a quite well-established research tradition. And what they are doing is, essentially, they have realized that all of the books of all of the libraries in the world, can be represented as this, as computer data, which is quite fascinating. We have scanned millions and millions of books, and we've allowed people to then use them in their humanities research by developing something called the Ngram viewer. The Ngram viewer turns all of these books from the 16th century and onward into one huge data set that you can then search, that you can process, that you can do statistical analysis of. And you can search for things like, how during time, in all of the literary heritage we have in English, have Albert Einstein, Sherlock Holmes, and Frankenstein compared. And as you see, we live in the age of Frankenstein and not the age of Albert Einstein. Slightly worrying, that, isn't it? Yes. And you can do the same, of course, for all kinds of concepts in literature. So you can see how hysteria, fibromyalgia, and burnout have varied over time in different kinds of literature. You can do research on different kinds of flu. You can do research on different kinds of concepts. And you can also look at Stockholm and Uppsala. This is an old battle. The red one is Stockholm. What it allows you to do is to view the literary heritage as software. And you can do this not only in the humanities. You can do it for many different sectors in society. So if you can digitize all of the books in the world, you can search them, you can process them, you can find different patterns in them, then you can do it for all other sectors as well. Now, there are 2 drivers here behind the computational turn. The 2 drivers are data growth and code power. I'm going to talk a little bit about them because I think they're important to understand, and I think they underpin a lot of the change that we will see coming. Data growth is the most important one. The amount of data in the world today is quite amazing. In fact, this is my favorite quote. This is from the BBC, where they said, nobody really knows because the volume is growing so fast. So we don't know how much data we have in the world. And if we look at the numbers, if we try to quantify this, we use terms like exabytes or terabytes or petabytes, but they don't really mean anything to us. So we found a better way of thinking about the size of data that we face as a society. And that is looking at the doubling rate of stored human knowledge. Now, if we look at the time it took for stored human knowledge to double between 1750 and 1900, it took 150 years. In 150 years, we took the installed base we had of human knowledge and we doubled it. In the 20th century, 1900 to 1950, the doubling rate of human knowledge was 50 years, stored human knowledge. 1950 to 1960, we were down to 10 years. The last decades of the 20th century, we saw a doubling rate every 5 years. Today, we know that we're doubling the amount of stored information every 18 months. If you think about that, it's not only that it's growing by a little, it is doubling every 18 months. We believe that sometime during the next 5 years or so, we'll see doubling rates at 72 days. And that is the amount of totally stored information in our societies that we can then use in much the same way as we can use the literary heritage that you saw earlier. We can search it, we can analyze it, and we can find patterns in it that allow us to innovate, that allow us to explore and research. The speed is increasing. We see a lot more data, but we also see the scope increasing. There is something in the computer science that is sometimes referred to as the Heidegger conjecture, after the German philosopher Martin Heidegger. Heidegger wrote a beautiful little essay about technology in which he asked the question, what does technology do? What is the basic, fundamental nature of technology? His answer was that technology takes the world and frames it. Technology makes the world available in different ways. If you have a forest and you have a sawmill, suddenly the forest is made available as wood. If you have digital technology, then what happens, of course, is that the world is made available as data. So more and more in the world is made available to us in different ways as data. And the most important driving trend here that we sometimes forget is the development of sensors. Now, sensor networks was for the longest time just a very small theoretical field of computer science. Today it's mainstream, and the prices of sensors are dropping much faster than the prices of anything else in the computing industry. Sensors have become biodegradable. So, for example, in agriculture today, it's not unusual for the farmer to actually sow his seeds and sensors that send back humidity, salinity, and acidity of his farm back to him so that the farm is made available as data. Of course, we've seen this also in the medical industry. There are tons of different sensors now. Not only the 8 to 10 to 15 different sensors you have in your mobile phone can be used to record health data, but there are also dedicated companies like Tinke or Scanadu that essentially work to bring sensors into every single person's hands so they become consumer technology and can then start collecting data. And health data is one of the most quickly growing personal data collection sets that exist. Our mobile phones are used today for anything from recording, how fast we run. You can record your pulse with them. You can record all kinds of things with them. And this will only continue to develop. We're moving towards, this sensor movement is also accompanied by a series of subcultures that are quickly becoming mainstream. One of the most interesting ones is something called the quantified self. The quantified self movement, for those of you who haven't heard of it, is a movement in which like-minded individuals, often engineers, often geeks and nerds like myself, decide to collect a lot of data about their lives in order to figure out what their lives look like. Because the first step in trying to change something is trying to understand the system you're changing. So you collect tons of data about yourself, and then you try to figure out how you can use the data to start hacking yourself. My favorite example is this. This is from Stephen Wolfram, who's a designer of Mathematica and a lot of other mathematical software, who has, since the early 1990s, been collecting data on everything he does. The number of keystrokes on his computer, how many steps he takes, how many calls he makes, and he's set up this enormous data collection mechanism so he can check exactly what he's doing. And he will then go through the data and he will ask himself questions about, why is there a white stripe there? And he goes back and he looks, oh, I was in Europe, that's why. And so there's a fascinating trove of data, and he wrote a lengthy blog post about this that has become sort of gospel in the quantified self movement. But this is not extreme behavior today. Collecting data about yourself, revealing yourself as data is far from extreme behavior. It's quickly becoming mainstream behavior. And the kinds of data you can get access to can actually be quite advanced. So for example, this is my 23andMe profile where I have some kind of version of a sequenced genetic database that tells me that I'm going to die first of coronary heart disease, then prostate cancer, and then get a thromboembolism, which is kind of depressing. The rest leg syndrome I probably won't be hit by, and then there's tons of other stuff that will happen. An enormous amount of people are now looking at personal genomics, looking at ways of creating data sets of themselves across the board. Not only emails, but also things like this. And we're sharing it. The website Patients Like Me, that you probably know about, is a website that allows patients to share with other patients all of the data that they've collected about their own histories, their own medical conditions, in order to be able to predict and find patients that are similar to them. So if there's a side effect to a medicine, they can say, I would like to avoid this particular medicine because other patients like me that avoided it also avoided the side effects, for example. So we share that data and we wear that data because more of this is coming. It's moving into, for example, our clothes. This is a t-shirt that Intel designed that I thought was very neat, that collects all kinds of data from you just by being your t-shirt. So, summing up, we're not living so much in an information society. We usually like to think we are, but we're living in a data society to a very high degree. The second driver behind this is code power. Or algorithm power. Code, the way we program the data, the way we search and analyze it, is also changing really quickly. And the most important trend there is that the cost of code, the cost of coding, is coming down. It used to be that you had to go to a university, you had to sit through an enormous amount of computer science lessons, and that can be kind of horrible, and then you could go coding, and it would take an enormous time to do this. What we see now is that code is becoming a little bit like Lego. You're building things and you're doing it very easily by using different very usable tools. One of my favorite examples of this is the website IFTTT. If this, then this. It allows you to connect any two web services that you're using and connect an action with them. So for example, if you want to, you can have your Facebook profile picture changes, then your Twitter profile picture changes. If it's raining tomorrow, you get a notification or an SMS or an email, and then whenever you're tagged in a Facebook photo, that photo can be taken to Dropbox. All of these different services can be brought together in a very simple pattern. If this, then this. And if this, then this, of course, also has tons of medical data. So if, for example, I am not exercising enough in 3 weeks, send an email to my best friend and have him call me. You can start programming the web, not only programming your computer, and the web holds all of these data sets that you are collecting with the new wealth of sensors. We see the app economy as a result of this, and we know that, for example, for Android, the number of apps are more than we ever saw for personal computers. The number of software programs that are generated is simply exploding because it's so easy to code, which means that you can code all kinds of applications very quickly. There's also dedicated coding tools for example, health. One of the large pieces of news that was kind of ignored when Apple had their press conference recently was that they've now developed a special health kit coding system, which allows them to just do coding on health data in an extremely efficient way, so that the mobile phone becomes even more of a health device. Lastly, code is becoming more powerful because it's becoming more smart. We've had a discussion about artificial intelligence for a long time, and it's sort of been discarded, and we said there will be no artificial intelligence for real. But we're actually at the point where we've been able to slice human intelligence quite thinly, and for every single thin task, we've been successful. We've been successful in designing computers that can beat humans at chess. We've even been successful in designing computers that can beat humans at Jeopardy. And this is IBM's Watson that beat the existing grandmasters of Jeopardy in a contest that was 2 years ago. And my favorite thing with this picture is that Watson just answered the question, wrote Dracula, and Tobe is Bram Stoker. And you can see that Watson is really like beating the others by far. And the then current champion writes, "Who is Stoker?" And then in parentheses, "I for one welcome our new computer overlords." Which is quite nice. After having beaten humans at Jeopardy, what did IBM do? Well, they sent Watson to medical school because they said, well, let's see if we can take another thin slice and at least build one of the best systems for figuring out particular diseases or figuring out particular medical practices. Code is also becoming embodied. The growth of robotics is something that we underestimate today because it seems so science fiction. But we've seen some amazing examples of how robotic prostheses can become not only a supplement or a substitution of what you had, but something that actually augments your human capacity. This is a drummer who now actually has 3 hands rather than 2, because he can use his drum prosthesis in an entirely new way. And that is done by artificial intelligence code in a piece of robotics. And robotics is developing very, very fast. So summing up then, code becomes cheaper, embodied, and smarter very, very fast. So with the enormous data growth and the growing power of code, we can see that those are both the key drivers of the computational turn. Now, challenges for healthcare. Let's think a little bit about what this means for healthcare. And again, I'm admitting here that this is your expertise, not mine, but I'm going to sort of just throw a couple of challenges out there because I think they're interesting. I mean, the first one that comes to mind, of course, is this. Well, how would we change healthcare if we had 100 times more data than we have today? And then preferably in useful formats and perhaps in a standardized format, just saying that. And what would we then do? Because everything we see indicates that we will have so much more data. I mean, not only from the fuel bands of the world, but we will have it from all of these services that you've seen, all of these data collection mechanisms, all of these sensors. How do we use that? What is our response to that wealth, this embarrassment of data that we're facing? Well, we also have to ask ourselves the second question, that is more data necessarily better? Because we can do pattern matching in data, and we do that quite well with artificial intelligence. But what we get is correlations. And it's important to remind ourselves that vast data sets don't necessarily give us causation, they give us correlation. Thinker and writer Nicholas Taleb has pointed out something that is quite disconcerting with vast data sets, and it's this. In large data sets, large deviations are vastly more attributable to noise or variance than to information or signal. The more variables, the more correlations that can show significance. Falsity grows faster than information. So how do we make this data useful that we are now facing in its embarrassing growth? Because there are so many correlations out there that are just spurious. And my favorite website, by the way, that I'm going to share with you is called Spurious Correlations. It's a statistician that in his free time just looks at very strange correlations, and here's a couple of my favorites. The US spending on science, space, and technology correlates with suicides by hanging, strangulation, and suffocation at 0.99. There has to be something there, right? Or this one. People are drowned after falling out of a fishing boat and marriage rate in Kentucky. This one is pretty obvious, so I'm not going to go into that yet. We risk ending up in a post hoc ergo propter hoc society, in one where we make this basic logical fallacy of believing that just because this happened after this, it is a cause of this thing is a cause of this. And we have to remember when we see this wealth of data that correlation is not a cause, SINAC. There may even be an upper boundary to the usefulness of data. So all of this sensor data growth might actually present more of a problem than an opportunity. And then what we need to figure out, and this is also for healthcare, is, how do we work with artificial intelligence? We will soon have the ability to make very advanced predictive statements about individual medical histories. But how does that fit into the practice we have, the image we have of the human doctor as supreme, our own skill sets and our own image of ourselves in this new industry? We will have to develop new skills. We will have to develop a division of labor between ourselves and artificial intelligence. And I think that we also have to develop a dialogue with computer scientists. Because when it comes to medicine and when it comes to healthcare, it's quite obvious that what we would like to do is to design something that is complementary and does not substitute the human role. So we would really like to have something that allows you to build a stronger team between machine and man than just a stronger machine. This is actually how chess has developed. When chess was solved, in the sense that artificial intelligence managed to beat all humans, what happened was that we saw a new form of chess develop, in which humans and machines team up against other humans and machines. That is now a quickly growing game, and it's a really exciting game because it's really hard to predict who will win. Again, man and machine teaming up is much stronger than either on their own. So, what about the future of healthcare then, given all of these things? The trends that we've looked, the computational turn. There are three things we see very clearly, and that's sort of our mainstream predictions. The three future trends are that we're moving towards a world with predictive medicine. It's very clear that we're going to try to predict, what kind of 30-day readmission rate do we have for this particular patient? What kind of costs will we have for this particular patient going down the line? And there are several different projects out there trying to improve our predictive algorithms. This is an old one from 2012 that is fairly well established as an example in the literature, and it's the Heritage Healthcare Challenge, where what essentially you could do is you could take historical claims data from the healthcare network, and you could try to predict who would be admitted to a hospital within the next year. And then what you did was you submitted a predictive algorithm that said these people will most likely be admitted next year based on these facts. And the algorithm that did best won a prize of 3 million. And this is just a starting point. We can do so much more. We will see a lot of mapping as well, because our technology is becoming better and better at that. And the really big medical initiative in the US right now is this brain initiative, whereby which the hope is that we can map the entire brain and understand it in some kind of computer model. We will also see a lot of simulation, which is not the same as mapping, but trying to build a system that replicates what we're simulating. And interestingly, this is how Europe approaches the brain. So whereas the US says, I'm not sure what this is, let's go look at it and figure it out and map it, the Europeans are saying, I'm not sure what this is, let's build a model and see if we can simulate something that works a little bit like the brain. Two radically different, but both computer science-driven approaches to medicine. But then finally, I would also like to point out that it's not only technology driving this. It's not only the fact that computer science has developed so fast that we have processors and sensors and all of these devices and gadgets. It's actually a perspective. It's a perspective on how we view knowledge and how we view our respective fields of expertise. And it's a fundamentally European perspective that comes from, or at least has its start with, this man. He's sadly forgotten, but actually has a great claim to be the father of the internet. His name is Paul Otlet. He was a Belgian, and he developed this. Looks a lot like a card registry, but in fact it was something called the Repertoire Bibliographique Universelle, and it's a search engine. This is the world's first search engine. What you did was that you wrote a letter to this repertoire with your question. Otlet went through all of these index cards. He had 400,000 to start with, a little bit more than 15 million when he ended. And then he would write a response to you. And he would warn you. He would say, this was in 1895. He would say, if you do not have a specified question, you risk getting more than 50 responses to your question. This is what it looked like in operation. These are the algorithms, and that's Paul Otlet in the middle. And they would answer 100 to 150 letters, essentially every single month. Otlet had a view of the world as essentially being something you can grasp, classify, categorize in data. You would start with the categorizations, you would build the encyclopedias, you would go to the bibliographies, you would then have books, sciences, intelligence, and the concepts at the top. He also understood early on that all medias would become one. The telephone, radio, phonograph, cinematic television, all of them would be digitized into this simple thing here that he called a screen, which is, of course, a computer screen, and it would be networked. This is again from his book called The Book of the Book, where he says that this is how things will develop. His ideas, his perspective is what underlies almost everything that we've seen so far in this presentation. If you add some of the tech that we have, you get this. This is the internet. It's a fascinating structure. It's a beautiful thing. It's not a web. You can see that, right? One of the things that we see when you watch this is that it's not a web. Actually, it's a kind of scale-free network. It's most it has these big hubs and lots of little nodes. It's most reminiscent of a biological structure. And you find several structures like this in nature, actually, that have really large hubs and then several nodes. So 20% of these hubs have 80% of the connections. You find it in different kinds of proteins, you find it in different kinds of ecologies, and you find it in high school sexual relationships. So, same kind of perspectives also underlie the work done here with self-driving cars. Same kind of idea that you can capture the world in data and you can build representations of it, and you can on these representations, act with artificial intelligences. So, this conference is about aging. I've already professed twice that I'm not an expert in your field, but I'm going to offer 3 observations that I spoke to my team about this, and that they had, and I thought were very, very good. And they said that there are 3 things that we now see happening that are quite interesting. The first is rise of recorded aging. We may well be the last generation that will not have recorded our age. We will be aging blindly because we don't have an idea of what that aging looked like down the road. Whereas it will be cheap and easy for people to record their aging going forward. That essentially offers you the opportunity to then have an individual amnesis, go back and look exactly at what happened, and then try to figure out how that implicates your current medical condition. The Bodyssey is a legacy system. Legacy systems are upgraded when they don't work anymore. That's the other trend we see in robotics right now. The thinking process there would allow us to view the body as something that we slowly replace. This is already happening. We're doing this with hip bones and other parts of the body, but this will become a much more pronounced phenomenon. And the last part I think is really interesting, and it's something that we call age gaming. And it's essentially about trying to find, in all the different decisions you do, data-based or evidence-based versions of how you can improve or lengthen your age. We try to make all of these decisions now, much more than we did before. We know smoking is bad for us, we don't do that. We try to stay off fat foods, and we have all of these. If you look at the wealth of advice, medical advice you find in daily press, it's quite fascinating. But as we get more precise and get more data, people will really do age gaming in a different way, figuring out exactly what they can do, and they will probably also get a much better predictive view of how old they will become. These things will fundamentally change how a patient interacts with healthcare. It will fundamentally change the view of what aging is as well. So with that, we're at 30 minutes. We've had a guiding question, a tentative answer, 2 drivers, 3 challenges, 3 future trends, 1 perspective, 3 observations, and so thank you for your patience.
Thank you, Nicklas. I just have to check, though, if what I've heard is a myth or the truth. Is it true that you gather a lot of data already about all your users and sell them to insurance companies so that they can predict our...
We don't sell data about our users to the insurance companies. In fact, we don't sell data about our users individually at all. We aggregate it into advertising data, and that we do sell. And we do sell advertising data in order to improve advertising. That's how we make our money, and I want to be completely honest about that.
Very good. Thanks. Richard?
Thank you very much. That was a very interesting presentation, although I must say as an academic, I was confused where data ended and where knowledge began. I didn't see knowledge in your presentation. I suppose that's a double entendre, but that's not fair. I have a simple question, hoping you can help us in thinking about what we've done here in the meeting, and particularly since you are representing governmental affairs. How do the well elderly ensure that they retain control over their data and that data is used with them rather than for them or, God forbid, against them? How do you how does an older person who may not be terribly computer literate, how do they retain control over their data?
It's a great question. I think it sort of breaks down into a couple of different questions. One is that we're in this transition now. We're a transitional generation, and for us it will actually be more difficult than for the other generations to come. If you go 300 years down the road and you try to think about this, then it will be a matter of course that you will have access to your data sets. The most important part of this is something that is usually referred to in policy circles as data portability. The right to take your data and leave. So if you're not happy about the way your data is being processed, or if you're not happy about the provider that is processing your data, you should have the right to take your data and leave.
But portability doesn't mean protecting or controlling.
No, it doesn't mean protecting, but it means that you at least have the ability to say, I'm not happy with the way that you're processing my data and I would like to take it elsewhere. So for example, at Google, we have this team called the Data Liberation Front in Chicago. Their only job is to make it as easy as possible to leave Google. Take all of your data and leave. Two reasons for that. First is that is how you build trust. You must tell somebody that it's okay for you to leave if you want them to trust you. The second thing is that it's a great innovation driver for our engineers because they know that if they're not good enough, people will leave. So I think that actually holds also for medical services. I think that also holds for the medical sector, that if you have that kind of freedom to take your data and leave, then you have the ability.
That's the key, if you have that kind of freedom. So the key then is to have the ability to control and steer your data, and that needs to be built into these new frameworks.
Yes, and I think there's where the huge challenge is also with the existing installed legacy-based systems, where a single hospital can have like 25 different journaling systems.
So there's a whole regulatory is a very strong word, but there's a whole new process to be developed that has to do with the relationship of the individual and particularly the elderly person and their data that needs to be built into systems like Google.
And it's two-way. It's really interesting because it's also going to be, users will be coming to their medical providers and they'll say, look, I have all of this wealth of data that is stored in the cloud about, when I've been exercising, what I've been eating, all that stuff. I want that to be a part of the medical analysis you make because that will make that analysis better. So the demands from the user to actually have their own collected data included is also going to present a really interesting situation and challenge the provider because they have to do a couple of things. They have to ensure data quality. They have to ensure that they get it in the right way, and they have to ensure the integrity and security of the data at rest.
So there will be some kind of a struggle over what we could call app control.
You could say it's app control, it's data control or app control.
Thank you.
Thank you.
But can it ever be erased? I mean, if you say, I take my... that's not possible, is it? You can't...
Well, I mean, it's an interesting question. Should you have the ability or right to erase all of your medical data or not? I think that we haven't actually had that discussion yet. You should have the ability definitely to erase all of your email. That's sort of a trivial thing, right? But should you have the ability to erase all of your medical data? Or should the state actually paternalistically step in and say, if you do that, the quality of care you get, especially when we're geared towards personalized medicine, it's going to drop so radically as to make you essentially helpless in the system. So we can't have you do that. And that's a question that we haven't discussed yet, but I'm sure we are going to.
Thank you very much. I know you want to go to the train, so thank you for coming.
Thank you.
Thank you.